This is Dr. Paul Seitz. As an experienced infectious disease epidemiologist who's worked on AIDS, TB, malaria, and hantavirus epidemics, meningococcal pneumonia over the years, I've taken it upon myself to diligently track the outbreak and response in the US and globally. And I'm here today to share my perspectives with all of you about what's happening and what else can happen in order to respond effectively to the pandemic. Some really good data now coming out that a certain percentage, not all, I'm not exactly sure if we know exactly what percentage of patients or people that get infected with COVID-19 actually experience this phenomena, but it's significant and it's been consistent across the world. So I just saw a New York Times article about Google Analytics that are looking at Google searches for loss of smell. And they show that the pattern of people searching for that question is correlated to a spike in the infection rate. So there is a way now that they're using that to sort of track where the epidemic may be occurring in ways that are different from the reported data. So for example, they showed a big spike in the population in Ecuador that are searching for that question, while the national reporting out of Ecuador doesn't show a very big epidemic, but it looks like there might be a very large epidemic in Ecuador. Why exactly that is happening, I think, is still being studied. There are neural pathways from the brain to your face to where the cranial nerves connect to your nose and to your mouth that allow for your taste and your smell function, senses to operate properly. So it's possible that the COVID infection is impeding those neural pathways and blocking them right at the point of most probable place where the infection is entering the body. So if you inhale a droplet or you inhale a droplet that includes the virus is binding to your cells in the nasopharynx, and the cranial nerves are running through that same zone. So there's possibly some interaction that's occurring right there. I haven't read any definitive report about how that is operating, but that's my deductive reasoning as of now. There will, of course, be people studying it. I think the really interesting question is this an early warning sign? So can we identify where there's an uptick of that, or for people, the public, if they start sensing that, is that an indication that they might have a COVID infection? That's a good indicator, especially if you're not able to get a test, because testing is still hard to get in many places of the country.